My name is Belinda Beck and I'm a Professor of Exercise Science at Griffith University on the Gold Coast, Australia, and I'm owner and director of the Bone Clinic in Brisbane, Australia, and I also contribute to the work of Healthy Bones Australia. I completed a PhD in research of mechanical loading of bone for animals, and then I went on to do a postdoctoral fellowship at Stanford University on clinical trials in women primarily and the effect of exercise on bone. And then I took a position at Griffith University and I've been here ever since teaching musculoskeletal anatomy and doing exercise science research, particularly again with the effect of exercise on bone. In recent years, we've undertaken a number of clinical trials to examine the effect of exercise for osteoporotic bone. This has created quite a conundrum because people with osteoporosis have fragile bones, and it's known that you need to load bone heavily to get any effect from it. The Lift More study, the Lift More for Men, and the MedXOP trials were three trials where we applied a high-intensity resistance and impact training intervention over 8 months against a low-intensity or lower-intensity exercise program and showed that this high-intensity program was effective at building bone and it could be done safely if it was supervised by people who were expert. So these are people like exercise physiologists and physiotherapists. Later, I then rolled the program out into an actual health clinic that is targeting the health of people with low bone mass, such as osteopenia and osteoporosis. And this is the Bone Clinic in Brisbane. This is a translational research facility where we apply what we call now the ONERO program to everybody who comes, and we track them closely by doing all the same kinds of research measures that we did in the clinical trials, and we measure them every year. Now we've found that the program is equally effective in the real world, in this clinical health service, as it was in the clinical trials, if we keep this close level of fidelity of the program and supervision for safety. So not only are bones growing, but bones are changing shape, people are falling and fracturing less, and they're becoming more functionally able. They're standing up straighter, so their posture is improving, and overall their quality of life is improving, and they're getting their lives back, whereas they, for some of them, thought their lives were over when they had a diagnosis of osteoporosis. It's really a very positive outcome and a culmination, if you like, of many years of work in this area. I've always been interested in bone, and as for many people when they're researching, it came from a very personal experience. I was a runner, I used to get leg pain, and in my drive throughout my research career to identify what was causing that pain from running and how I could prevent it, it took me down this track to identify the optimum way to not only to prevent stress fractures for athletes and in the military, but to provide this fabulous exercise program for people with osteoporosis. So overall, I would say what keeps my drive to keep doing this kind of research is just a fascination for bone, the amazing way that it adapts to mechanical loading, and it does so in ways that we can control and we can keep people safe, and taking advantage of this innate ability of bone tissue to adapt. It's phenomenal. I have many, many interests outside work, but I get very little time to do them because I would say that work is also my hobby because I love what I do. I do love to be outside, anything to do with camping and being out in nature, particularly like the mountains and the beach, but the mountains are my love. The bush in Australia. I'm also interested in politics and keeping track of current events. I do a lot of reading, both fiction and non-fiction. And I love to hang out with my family. My kids are grown up now, but they're still nice people.